Good evening, good evening, good evening, ladies and gentlemen. um, I'm trying to turn off all of my alerts right now. Stuff is just popping up right now. I thought they were off already. All right, here we go. Ta-da! All right, thank you for joining me today for another episode of Campbell Talk. And today we have the one, the only, uh, Miss Taylor Santiago. And she is going to come on. We're going to talk a little bit about who she is, the work that she's doing in the community, and kind of like, opportunities for you to get involved and things of that nature. And as always, we'll sprinkle some education in here. And if just in case you've missed the last show, please go back and check it out on our Facebook, LinkedIn, or YouTube. Um, and it's soon to be up on the podcast. We've been talking about Hispanic Heritage Month or Latinx Heritage Month, and also Latinx HIV/AIDS Awareness Day, which is this Saturday, October 15th. Um, and if you are available, bring a friend, bring someone with you. Come on down to Triple H Ministries, which is at 3600 Broadway. They are hosting a health fair, I believe from 10 to 2 p.m. Come on out. There'll be food. There'll be testing opportunities available. There's lots of information and lots of resources that you can get. Bring a friend, bring a community member. Come on out. And she's celebrating 11 years of providing services to that community. So absolutely come on out. And as we do always, please, 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 here's a time when you get involved. It's you, it's you, it's you. Um, like, share, subscribe, invite somebody to watch. This is your opportunity to send a link to a friend, text somebody, tell them to come watch this. And when we come back after the intro, Miss Taylor Santiago will be here to tell us about herself. Thank you. Welcome, welcome, welcome.
Hi,
How are you?
I'm good. Thank you for having me. I'm excited. And I
I
talk a lot too, so I'm hoping I don't run my mouth too much.
right? You know what? That's what we're here for. We're
hmm
here to help the community to get as much information as possible, to get as much resources as possible. So yeah. So let's dish, okay? Ladies and gentlemen, damas y caballeros, I present to you Miss Taylor Santiago.
Thank you.
Tell us about yourself, Taylor.
All right. Well, I've been working in the field for about over 7 years now, focusing on HIV prevention, but I did dip and dab a little bit with case management and treatment. However, prevention is kind of where my heart's at, and I think it's something that I'm very passionate about. Also, I am in school. I go to Palm Beach Atlantic University for community psychology. However, I do want to get my MPH, hopefully at FAMU. So, got to make sure that my transcripts are looking okay for the application process. I'm also really big about promoting sexual health and wellness in the Hispanic community, being a daughter of Hispanic immigrant parents. I've definitely noticed that there's a lot of health disparities in this community, and I've noticed that very young. I remember as a child having to go to Caridad and help family members translate and help them with the paperwork, because I mean they had poor health literacy. Obviously, it was very difficult for them to navigate the healthcare system here in the states and also in their home country. So this is very important to me as far as awareness for access to equitable healthcare, but more importantly, sexual health and wellness and HIV prevention.
Thank you. So that means we have lots to discuss.
Yeah, a lot to unpack, definitely.
So, you mentioned, like your parents were immigrants,
Mhm.
or who lived here. My parents came here as immigrants as well, and I also lived here as an immigrant for a couple of years before I became a resident and a citizen. So, I know all too well that experience, that those feelings. So, since as we work in this realm of like HIV and STDs, how what would you say are some of the challenges for people who are migrating or or immigrate, if that's the
I
word,
think migrating is a better word. Yeah,
migrating to the United States, and kind of like not knowing the language, not knowing the resources, and not knowing where they can get help. What are some of the challenges around that?
so I think first and foremost, I mean, even in the countries that people come from, a lot of the healthcare systems are broken. So they're not even used to accessing equitable healthcare in their home countries, let alone coming to a whole entire different country with different language, like you said, language barriers. So I think that's first and foremost. They are not even used to just getting a regular physical. HIV, routine HIV testing, it doesn't exist unless, you're high risk, or, there's maybe some type of targeted outreach if that's the case over there. But for the most part, it's not very common.
Right.
Um, and then coming here, even people who speak English, who may have access to healthcare coverage, still have difficulty accessing healthcare here in the States. So for someone who doesn't speak the language, who may not have all the documents needed or are undocumented in general, um, they're unable to really access private physicians. They have to go to public healthcare settings, or somewhere that's free. Some of them rely on health fairs and other wellness fairs to get basic health screenings. um, so it's kind of a combination of factors, and also I think it's probably the distrust with the healthcare system here in the States as well. I think it's another thing I've noticed with a lot of folks that migrated from other countries. When I engage with them, and especially my family, it's, is this person trustworthy as far as maybe the physician they'll be seeing? Is this a reputable healthcare agency? Um, some people fear, uh, just accessing any type of government or federal healthcare agency because of their immigration status. So there's so much that can really affect how people even go about getting their basic healthcare needs met. And it's really unfortunate because people of color, and it's right now for this purpose for Hispanic Heritage Month, Hispanic folks, they just it's not a thing. It's more like survival, and survival meaning work, put food on the table, and kind of put everything else on the back burner, such as healthcare, dental, sexual health. All of that is almost non-existent unless it's a dire need. Like
Right.
usually they seek medical services when it's either too late, or it's at this point it's an emergency.
Absolutely. The and I can remember like not the way how the community pulled together to protect itself. It's you can't really trust anyone outside the community when you're not in a when you're not when you don't have like your green card or citizenship. It's just kind of like you're like locked into your community, and you only kind of like trust those folks in there, um, because you don't want to end up in a situation where you get deported. You don't want to end up in a situation where you get arrested. Like, so it's this, so it's that, but it continues to push people into those pockets, because now they might actually have uh, a serious condition, or they might actually have, an STD or HIV or some other illness that they need to get taken care of. But because of their status, it makes it more challenging. And I think you mentioned earlier, you said, like in some of their countries, they may not have those resources. And I know, like I'm Jamaican, and I know like a lot of people don't usually go to the doctor until like something is broken, or it's a must, because it's not preventative health. What's that?
Yeah.
you
Mhm.
know so I think it's in relearning, or not relearning, but in learning how to access preventative health, and in learning how beneficial preventative health is for you. It does take a certain type of personality and a certain type of person, excuse me, to really be able to provide that education to that community, so this way they can understand the importance and access. Have you find that to be very challenging for people to understand these benefits?
Oh, absolutely. Um, I think, well, and as you were speaking, I was also thinking of other factors that just contribute. It's because, again, it's so many. Um, like you said, preventative health care. People don't really, even Americans here that have access to healthcare, well, somewhat access to healthcare, don't, really take advantage of that. But what I've noticed is, for example, if someone is undocumented, um, and they need to go see a doctor, they're undocumented, they are working under the table type of job, and if they miss work, they don't have PTO or sick day that they can take to compensate for that missed day, or even have the liberty to take the day off. Like, no, you're going to work this schedule, and it's kind of, if you don't come in, you don't have a job.
Yeah.
So it's almost like, again, survival. You're choosing between preventative health or just general health care versus putting food on the table. And that's kind of where it comes in for this population, unfortunately. And this also applies to folks who are dealing with this similar situation that are not immigrants, folks that
Right.
are, residents and citizens, and also have these type of challenges.
And I think it's important to understand that, if you are looking, or if you are working with an entity that provides services to people who are migrated to the United States, or just to Black and Brown people as a whole, you have to understand that there are cultural barriers and cultural, linguistic issues and things that can come up that might make that linkage, that navigation, those resources not be received or not accessible for some people. And so it's not a matter of saying, oh, well, I'm trying to give them this and I'm trying to share this and they don't want it, and walking away. It's kind of like understanding that there are challenges, and sometimes what we don't see as a barrier, just because it's not a barrier for us, doesn't mean that it's not a barrier for somebody else. And
Mm-hmm.
so we have to provide service in such a way where we're able to really get to know the individuals on or the community members on an individual level, so this way we can really get to the heart of what those challenges are.
Absolutely. And I love that you mentioned about language barriers. And besides, English and Spanish or Creole, some folks who come from Spanish speaking countries or Latin countries don't even speak Spanish. They might speak a different dialect of, that country, and come here and still have challenges
Mhm.
communicating with people. Because I've experienced it, doing outreach out in the field or testing, and I'm attempting to engage, and they speak a little bit of Spanish because they speak dialect, and they're indigenous folks
Mhm.
from Central America. So it was difficult, and it's unfortunate because we don't have a lot of people that are able to translate, because the language is not very common, at least here in the United States. And it's real. I've definitely had my encounters over the years of folks that just aren't able to communicate, not even in Spanish, English, Creole.
Yep.
Um, I, and then from there, you figure out how can you really help this person, and like you said, really, do that real navigation and linkage, because now we have a barrier as the advocates,
Mhm.
um, and we have to figure out how to overcome that.
And I can give you like, I guess, so many examples of how, this sometimes healthcare can fail people, right? So my grandfather was living here before he passed away, and of course, Jamaicans, we speak English, right? We speak we speak what we call patois or patois, but it is a combination of a little bit of like African, Spanish, English, whatever the case is. But my grandfather spoke it had like a very deep accent with it, right? He was at the doctor's office and he was trying to explain to the doctor what was wrong or how he was feeling, and the doctor kept trying to say to him like, yeah, I don't know, but can you speak English? And he's like, I'm speaking English.
Um,
And so he got frustrated with that process and was just kind of like, well, I don't understand why this lady's looking at me like I'm stupid or I'm crazy. Like, I'm telling her what's wrong, I speak English. And so it's our dialect is English for us, and it is English, and it's just when people don't understand, they're like, oh, you're speaking that, whatever, I don't really know what it is. And so there's no effort went in go into it to say, let me find another staff who's Caribbean who could probably explain or better understand, or whatever the resources are. And then I had a friend who is from Guatemala. He is darker than I am, or like just chocolatey. And we were walking down the street, and we were at a conference once, and they were doing like a Spanish group. And so we were like, they were passing out the flyer, and when it got to us, they kind of like stopped handing out the flyers and was like, they just walked around us, and we're like, what happened? So he turned around and he was like, what happened to us? We don't get a flyer. And he was like, oh yeah, well, it's a Spanish group for Spanish people. And he was like, but you didn't ask me if I was Spanish. You didn't ask me where I was from. So people make those assumptions that just because you have dark, black or brown skin, that sometimes you don't speak a particular language, or is aware of what a particular language is. And so, of course, he kind of like just blasts them right there on the street and blast them in Spanish, and and then he, there was like 1,000 apologies. But I mean, imagine how many people they've walked by
yeah,
who, just because of the color of their skin, they assume was not Hispanic or Latino. So it was just one of those.
absolutely. And I think that's probably another challenge too, like with Hispanic folks interacting with each other, is colorism.
Hmm.
Because, like you said, they just make assumptions based off your skin tone. Um, but me, when I work with individuals out in the community, and maybe I'm not too sure what their nationality is, or maybe I know their nationality, I still can't assume that they don't speak Spanish or they're not Hispanic either, because some people are, mixed race. So my tactic is, if I'm engaging with someone and there's a language barrier, I'll ask them, if they speak Spanish, you speak Creole. Let's try to find a common ground so we can get them, the proper translation services. And I also do this a lot with Haitian folks. A lot of them are multilingual.
Hmm.
So if I'm engaging with someone, maybe they don't speak English, and my Creole is very minimum. I've always feel comfortable to ask, if they speak Spanish, and sometimes they do, and they actually speak it better than I do. And I'm able to provide a service that way. And I actually had a very successful HIV testing session. A Haitian woman came in for testing. I took her to the room. She said, her English is no good. I'm like, okay, no problem. And I was like, do you speak another language? And she said, yes, that she speaks Spanish, and she spoke it so perfectly. And I didn't even have to go through the trouble of trying to find a staff member that speaks Creole, because I did my due diligence to ask her if there's another language that she speaks
Hmm.
before we even go through that. And she did. And it turns out that she studied in Mexico for over 10 years. She went to grad school. So she spoke the language very well. Um, it's unfortunate that folks in this field do make those assumptions, and I can't blame them 100% because colorism is instilled in Hispanic households, um, and unfortunately, it's not going to change. I don't think, just because it's
We need some
always associating, yeah, always associating color with your identity
yeah.
as opposed to your roots, and and like you said, your friend was from Guatemala and he was dark skinned. And same thing in Honduras, where my family's from. Depending on the part of Honduras, you can be lighter than me or darker than your friend, depending on the region that they're from. But they're all from Honduras, and most of them speak Spanish and maybe another language, a dialect. So the assumptions, I always make sure that I don't make them, only because 9 times out of 10 there's a solution, and we're able to still provide the service, um, regardless of language barriers.
Yeah, absolutely. I think all of what this says is that there's just more to be done, and we as a community of health professionals have to continue to advance this area, so this way we can really get to the heart of it, because we can't help people if we can't get past these we can't get past the language, we can't get past the culture, and it's just one of those things where it's until we can navigate those effectively, we're probably still going to have challenges when addressing those issues. and then,
Absolutely.
and then this one also for my Creole speakers. I caught some folks too saying, I was like, so not everyone who speak Creole is from Haiti.
Correct. Absolutely.
There are other countries who speak Creole. And
Yes.
so it's important for people to understand, like, hey, listen, just because you hear a Creole, someone speaking Creole, doesn't mean that they're automatically from Haiti.
Yep.
Uh, it just drives me up the wall sometimes. And I understand. I understand we're in South Florida. The closest place to us is Haiti right now, and there are like Haitian communities around and whatever. But at the end of the day, we have to stop making those assumptions.
Absolutely. And I actually encountered someone that was from Dominica, and they speak Creole. They don't speak Haitian Creole, but they speak Creole. I think it's French
Right.
Creole. And they told me that they've had experiences where people have assumed that, they hear them speaking patois because they'll speak patois as well, that they don't speak Creole. And unfortunately, someone was talking poorly of them in front of them in Creole. And they responded in Creole, like, I just understood everything you said. Um, and I actually speak Creole as well. So we can never assume. That's why I make sure I say whatever I need to say. And I make sure that if anyone hears, it's okay, because people are, multilingual, and regardless of what they look like, it's always, I can never be surprised anymore as far
Right.
as people speaking different languages. And again, I think it's just something that we're so used to, is if you are a certain color, you speak this language. If you sound like you're from the islands or look like you're from the islands, you speak only that language. And that's something that we have to eventually break.
Yeah.
And it also has to do with our culture and our upbringing, because you did mention something about culture as well. It's part of our culture also not to talk about sex, especially with your parents. That's like, awkward. I think the only sex talk that happens, at least in Hispanic households, is, maybe the boy, if, a boy is being raised, is, don't get anyone pregnant. And if it's a girl,
Don't
don't
get
have sex. Yeah, don't get pregnant. There's nothing about sexual health and wellness, sex positivity, HIV, STIs. Um, they just kind of drill pregnancy in your head, and then that's about it. There's
right.
nothing.
And there's so much more to wearing a condom than just pregnancy,
Yep.
or It's almost the way how it's talked about is that the condom is not just condom doesn't do anything else, right? Condom doesn't. The only thing condom is for is to prevent you from getting pregnant. But condom is more valuable in a lot of scenarios.
Hmm.
Chlamydia, gonorrhea, syphilis, HIV. Condoms are effective if used correctly.
Absolutely. And again, going back to um, conversations that I had, like I know me growing up in a very Hispanic household, that was, I mean, I don't think I knew what STIs were until I was like graduating high school, maybe. Um, just because it's not something that's common. And now, as an adult, when I speak to my parents about the work I do and HIV and STIs, it sounds like it sounds like foreign language to them. They have no idea what these things are, just because it's not part of their culture. It's and even like my grandma's generation, I don't even think they know what condoms are. I mean, my grandma had 10 children. So, think about those 10 children and one of the 10 being my mom. They're not getting that education from my grandma either because, it's just, well, 10 kids. Obviously, there was
Right.
no protection. No, I don't even know if condoms were invented back then, but at some point,
They
you know,
were.
the health, um, overall sexual health and wellness, it's not a conversation. It's either you have kids, that's your job, or you just don't have kids until you're married. That it was kind of like either or. That was it. So that was instilled into the next generation, and then it's instilled to my generation. But I am breaking that. To me, generational curse. I think that's a generational curse that we're not getting enough
Yes.
sex education, especially young. I was in my 20s when I finally got vaccinated for HPV, when that's something that you should do as a child. But because parents hear sex and
Mhm.
they associate the vaccine with sex, it's it's forbidden. Um,
I want to throw a little plug in here.
yes, yes, yes.
um, I'm gonna get to the comments in a few minutes, but
Okay.
Campbell Health Solutions, which is us, we have a sexual health education that we can do with individuals and families virtually to help you to better understand and know and learn how to what sexual health means to you as an individual. But let's say if you are watching this and you are a parent and you just don't know how to talk to your kids about sex, or how to talk to them about sexual health, you can reach out to us. And I'll put the information up in a little bit. You can reach out to us. Um, and basically, you can give us a call. You can do the same thing. You can give us a call for your free HIV testing too, but you can also give us a call and schedule an educational session for yourself. We will walk you through and talk about some of the different things that you need to know about sexual health. So this way, you are able to then sit down and talk to your kids, or your grandbabies, or your great grandbabies, nieces and nephews.
Hmm.
And then even after you get that information, you might say, you know what? I don't really feel comfortable, maybe because they might have tons of questions and I don't know how to answer. We can set up a virtual session and we'll be able to provide this education to your kids, to your grandbabies, nieces and nephews. Um, and it's all free of charge. So that's a service that we have available. We can talk about sexual health. We can also we have another one that we talk about LGBTQ. So for families who have, you know, kids, relatives that are coming out and saying, and say, hey, look, I'm coming out. I'm gay. I'm lesbian. I'm transgender. I'm bisexual. We can help you to kind of like put all of that in perspective, by helping you to better understand your child or your relative, and how to be kind of like respectful and appropriate and all of that. And so if that's something that sounds interesting to you and like you would like some of those resources, we have them here at Campbell Health. So definitely reach out to us and we can get you on your way. Um, Mary said, I think that it's because that's how the older generation was raised, not to talk about sex, and it's passed down. So it's up to the new generation to do it.
Absolutely. I definitely agree. And I think this is where I play a role, not just in, the work setting, but personally as well. I advocate for my friends who are also, dealing with this, same situation where their parents can talk to them about sexual health and wellness. And unfortunately, it actually turned for the worse for some of them. One friend in particular also did not get that talk, right. It was more of the pregnancy, don't get anyone pregnant talk.
Mhm.
And unfortunately, I think it was maybe in his early 20s. Unfortunately, he did test positive for HIV when there could have been just a little prevention education in there, or, someone to instill that information into him so he could have took appropriate measures to, protect himself and prevent something like that from happening. And unfortunately, when the family found out about the status, they kind of shunned him. So it's it's unfortunate. And of course, they're from the Caribbean. They're so it's again not a conversation to be had that, oh, you are part of the LGBT community and you're HIV positive. So like that's two reasons for us to stay away. And those are some of the issues with not having those sex positivity conversations, or refer to someone like Campbell Health Solutions to do it for you, because it is uncomfortable. Some people do find it very awkward, to speak to their child about it. Um, but my suggestion is to just take that leap of faith and do it, because you could be saving someone's life. You can prevent, certain chronic infections that they don't have to deal with, because I think parents, and I'm not a parent, but this is just my assumption. I think parents are focused on now and how can I help my child now and protect my baby now. But something as simple as a vaccine or a conversation can really go a long way for that child.
Yeah. And I think also too, when people hear, sex brings up all sorts of different things, right, for people. But I think when people, when teenagers or young, young adults, or teenagers and young adults, I should say, start asking questions about sex or sexuality, it's not something to shy away from. I think more parents should really embrace that, because now you have the opportunity to really provide information that is going to be valuable to your child. So this way they won't go outside trying to find this information from somebody else who could railroad them or who can derail their future. And so that's oftentimes what happens, is that parents are so afraid of talking about sex and sexuality. Then they start going to some, oh, my friend said, and my friend said, and my friend said, and then they get the wrong information. And then they end up with HIV, they end up with STD, they end up pregnant, because parents aren't really talking about that. And we're not demonizing parents, we're not bashing parents. You know, we're a product of how we were raised,
Yeah.
and so we're not it's we're not blaming you for not having the information. What we're saying is that there is information available now, and that there are resources available that you can utilize to break, like Taylor said, these generational
Yeah,
curses.
that's exactly what it is.
Because we want to see, and we work in HIV prevention, and so we see people living with HIV and dying from HIV, and we see the discrimination and the challenges they face. And so it's important that if we can do anything to prevent that from happening, that's where we would need to start. And actually, sexual health and the education of sexual health is a huge factor in how it can help to prevent people from acquiring HIV and STDs. Because what we do and how we teach it, we start with basically like knowing your body and loving your body, right? And so I have a 14-year-old. And so when he was about 10, 11, he started asking questions. He wanted to know what a condom was. He wanted to know what, what was sex and all this other stuff. And so we created a safe space in our, so when it comes to sex and sexuality, we wanted to be the ones who had that conversation with him first. We
Mhm.
didn't want the outside impacts, and then we have to sit there and kind of like troubleshoot later on. We
Mhm.
wanted to be at the forefront of this to say, listen, even if we don't know the answers, let's go find out together. Let's look it up. Let's talk to someone, who might be able to provide us, or so this way we can make those decisions together. But we don't go, oh, sex, no, we're not talking about that, we're not this, we're not that. And
Yeah.
sometimes parents get like that, right? And I've seen it. We have health fairs, and the kids come over and they're picking up the condoms, and parents are like, no, 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 no. And I just use that as an opportunity. I said, hey, do you know what that is? Why are you picking that up? Do you know what that is? And they're
Yeah.
like, no. And most of the times, the kids think that it's candy, right?
Yes.
Because, and I think sometimes what also freaks parents out, and I've had those experiences as parents, is that when our kids are asking us questions, we go to kind of like where our adult brains are. And so when you see your kid pick up a condom, we think, oh my God, they're picking up condoms, they're having sex. We go to like the worst extreme as parents. And sometimes they're just picking it up because it's there.
Yep.
And they're asking questions because it's there, not because they want to go have sex. Like, talking to someone about condom and safety and sexuality doesn't make them more likely to have sex. It makes them understand their bodies. It makes them respect their bodies. And when someone love and respect their bodies, they're less likely to stay quiet when someone is violating that.
Absolutely.
So yeah. Palm Beach County Care Council is out in Puerto Rico at USCHA conference, and they say we're missing you at the 2022 USCA conference. We're
I'm
missing
jealous.
we're missing you guys too. We're holding it down here while you guys are soaking up the information to bring back to us. So we'll see you guys when you come back. Be safe, have fun. Um, in the meantime, me and Taylor got this. We got this.
Yes. Yes. Take extra pictures because I
Yes,
see quite a few people are in Puerto Rico for the conference right now, and I'm like, but
yes,
they're
uh,
always making the opportunity. So
yes. And right now, since we're talking about USCA, USCHA, if you're not aware of what it is, it stands for the United States Conference on HIV and AIDS. And now we will tell you what HIV is. HIV stands for human immunodeficiency virus. It is a virus that is transmitted sexually majority of the time, but you can transmit it through breast milk from mother to child, or from sharing needles. Um, Most of the times when it's transmitted sexually, it's through unprotected sex. So that's why it's important for people to know um, their partner's HIV status. And the only way to know the only way to know your HIV status, know yours and your partner's, right? If you are going to avail yourself to someone and you're going to give your body over to someone in a sexual way, then you should know what they're availing to you. And so if you're having sex with someone, you should definitely ask about their HIV status. And you guys should go and get tested together. It's that simple. And we have HIV testing available here at Campbell Health Solutions for free, for free. And we have at home test kits. So you can stop by, pick up a test kit, and go home and do it, or you can get it done here. It takes 15 minutes. You're in and you're out. It's that simple. Um, But you cannot. Sometimes when people hear HIV, they think the worst, right? Like, oh my God, whatever the case says. You cannot transmit HIV through blood from you cannot transmit HIV through tears, hugging someone, kissing someone, eating off the same plate, dancing with someone, sleeping in the same bed. I mean, if you're not having sex, like if you're just like laying in the same bed, uh,
Sleepover.
sleepover, right? Eating off the same cup, drinking out the same cup, eating off the same utensils. HIV is not transmitted those ways. HIV is only transmitted through sharing needles, mother to child through breast milk, vaginal secretions, anal secretions, and such alike. Um, and the only way to know, if you want to know if you have HIV or not, the only way to know is to go and get an HIV test. If you have never been tested, this is your opportunity. Go get tested. If you are getting into a new relationship with someone, you should definitely be talking about HIV. You should definitely go and get tested together so you can start off on a clean slate. Um, and um, if you feel like you're not sure if your partner is being faithful towards you, or the person who you're just starting to date, if it may not be as forthcoming or whatever the case is, we are not introducing distrust to your relationship. We're just saying, if you feel that way, or if you just generally feel like, what, I'm just kind of like, having my cake and eat it right now. So I'm having sex with whoever I want, whenever I want. You can ask us about PrEP, pre-exposure prophylaxis. It's a pill you take every day to prevent you from getting HIV. Um, we also have post-exposure prophylaxis. So if you go on a date and you had an adult sleepover and you wasn't sure if you why are you laughing, Taylor?
No comment. I'm living for the adult sleepover though.
The adult sleepover. Yes, if you had an adult sleepover and you did not bring your raincoat,
Your party
your
hat.
your condoms, and you're not sure, you had intercourse with someone and you're not sure of their HIV status, you have 72 hours in which that you need to get to a community-based organization or medical facility, or some emergency room offers it as well, where you can get PEP, and it stands for post-exposure prophylaxis, and that is a pill that you take every day for 28 to 30 days. That is basically going to flood your body with enough medication in an attempt to kick HIV out before it has the chance to grab hold and start creating and start growing. Um, but you have to take it within 72 hours. The closer to 12 hours, the closer to the least amount of time frame is better than the greater amount of time frame, because the closer you get to 72 hours, your window starts to close, so you want to take it as soon as possible. So if you have questions about any of those things, feel free to reach out to us and we can definitely provide you with information and resources. Mary is asking, are there resources available in New York? Absolutely. New York has tons of information and tons of organization. So, one that jumped out of the top of my head is you have Gay Men's Health Crisis. And I know I said Gay Men's Health Crisis, but they don't just serve gay men. Um, it's one of the oldest LGBTQ HIV advocacy organization in the United States. Started by five friends in the 80s when HIV and AIDS was killing people literally within weeks of finding out their diagnosis. So five friends got together and started Gay Men's Health Crisis, and they provide services to men, women, um, people who migrated here, um, and from anywhere in the world. As if you're in New York City, you can go to their office in Manhattan and you can get services there. Also, there is Colin Lord. Um, uh, health alternative for teens in Brooklyn, the Door. I mean, there's so many other places too that you can find. I believe if you just Google HIV services NYC, that's there. But if you want more specific resources, please give me a call and I can be sure to help you connect to more specific resources. Um, Absolutely. Taylor?
And that's a good spiel.
I know, right? My adult sleepover.
And one thing that I usually tell people when I'm testing them is when pretty much what you said, when you get a new partner, go ahead and get tested together. So no one's trying to blame, you know, the other, oh, you may have this, or I think you have that. It's we're gonna get tested together. And I don't just limit it to HIV. I always encourage STD panels as well. And if they are females, I tell them to actually go get a pap smear. Because a lot of times when I'm speaking with some of my female clients, they haven't seen, a gynecologist in however many years, or haven't had a well woman exam, so they can get more comprehensive STI testing with the pap smear. So I always talk about that with female clients, and then encourage them to encourage their partners to get tested, because obviously HIV testing is very important. But I look at everything as a whole. Like STIs, should be included right along with it. Of course, HIV testing is always more convenient, cheaper, more accessible, but it's going to save themselves some trouble in the long run if they just go ahead and get an STD panel out the way, and determine if they're going to be monogamous, or however their sexual health looks like, that works best for them.
Yeah, absolutely. Then you should get, listen, any of your pink parts that you're having sex with, you should get tested.
Yep, absolutely. Absolutely. Because I always tell them, yes, make sure you get 3 site testing.
Yeah.
Because it's, it can happen. You can have something up here and nothing down there. And I've seen it happen with, in my experience with work. So definitely just getting everything swabbed and stuck. I mean, I know some people hate going to clinics, or they hate, needles, and I definitely understand. But I always try to tell them it's, you're going to hate it more if you have to come back for something. So
Mhm.
it's always easier just to get it out of the way, kind of overcome that fear. And then you have the peace of mind as well.
Absolutely. Absolutely. 3 point swab. I like that.
Yes. The 3 site swab.
The 3 site swab.
Yeah.
Absolutely. And if you want to know what those 3 sites are, give us a call.
Yes.
Yeah, no, yeah, and that's important, and especially for anyone who is anally receptive, you should definitely be also getting an anal pap on an annual basis as well. So don't just wait until you're in your 40s and 50s. If you're anally receptive, you should be getting that done annually. That goes for whoever. It's not gender specific.
Yeah.
Yeah. All right. So I want to thank everyone in the comments for their comments and for their well wishes from the USCA HA conference. USCHA. What am I saying? USCHA.
There you go.
Right. Conference. Our some of our care council folks are there, and some of our CBOs and FBOs from the local area is hanging out in Puerto Rico at the USCHA conference, and learning wonderful information. So, um, if you would like to kind of like learn more about HIV, learn more about STDs, learn more about sexual health, how to talk to your kids about sex and sexuality, and just want additional resources just to educate yourself so you can talk to your children or your teens, or you want to schedule a session for your teenager or your child, you can feel free to reach out to us either on our website, or you can give us a call at 561-208-6595. We are here to help. And all of the stuff that we do, they're age appropriate. So, of course, we will not, if we're talking to a kid in like elementary school or middle school, it's a whole different level of conversation. You always want to start with body positivity. You always want to talk so they understand why simple things like here's why you need to wash your armpits. Here's why you need to wash down there. Here's why like here's what you can expect as you grow up, as you age. So this way it's not just these things, right? Because one of the things too is, as teenagers, particularly boys, as they get older, they watch a lot of porn. And not everything that's in porn is exactly how sex happened. That's not exactly it. And sometimes people put that in their heads, and so they want to do these porn scenes in their head, and that's not it. So we have to teach people how to be a little bit more responsible, about protecting themselves and protecting the people that they're having sex with, so this way everyone can um, stay negative if everyone is negative. And if there are any serodiscordant couples, then we can prevent the future spread of HIV. Because we want to get to a generation where we don't have to worry about HIV. And we also want to get to a place where the burden of HIV is not just sitting with Black and Brown people. Any final comments, Taylor, before we go?
You said if have any comments?
Final comments, yeah.
Final comments. Um, I think we kind of covered everything. And I really love some of the things that you brought out as well, like speaking to the youth. I think that's probably going to be like my biggest thing is for Black and Brown households. Like there has to be a conversation at some point with, the adolescents, because when they get older, they become a statistic.
Mm-hmm.
We are the most affected by HIV and all the other STIs or really diseases in general. So it's just really important that they have those conversations, because just from what I've witnessed through work and in my personal life, there's so many things that could have been avoided or prevented if there was a conversation initially, whether it was from a trusted adult in the family or their parents, but someone, that's trustworthy and able to have, like you said, an age appropriate conversation. Because now as we, get older, again, they become statistics, and now they have to deal with the complications of, HIV and other STIs that, may not necessarily have a cure.
Yeah, and I think it's because people become so fearful of just talking.
Yeah, absolutely.
Is this it's just understand that it's it's going to be beneficial. It's going to help. It's going to prevent so many different things, and you'll have that assurance, right? That
Mhm.
you provided the right information. So now your child can make a conscious effort, or make like a what do you call it, critical decision when the time comes, when someone is saying, hey, let's go have sex. They might say, wait a minute, do you have a condom, if they're sexually active? Or they might say, I'm not sexually active and I don't want to have an STD, so I'm going to wait. And that's the other part too, because in part of our conversation we do talk about abstinence. We do talk, well, the way we talk about abstinence is from a neutral perspective, because we know that there are different religious groups and different religious teachings and beliefs. And so what might work for one group may not work for the other, but we talk about abstinence from a neutral platform. So it's not wait it's not wait until you're married, or because the Bible said so, or the Quran, or the whatever religious book said so. We teach it from a neutral space of saying you don't have all the stress of all of that to worry about. You can have sex when you are mentally, emotionally, physically, financially able to handle the responsibilities that come with sex, and you don't have to feel pressured. You know, you can have sex when the time is right for you to have sex, when you can handle all of those responsibility. It's a very emotional thing. It can affect you mentally. It can definitely affect you financially and physically. And so it's important that you understand all of these aspects of why waiting can be more beneficial to you in the long run, and not just saying, oh, because God said so, or because and so and if that's your perspective, that's fine. We're not taking that away from you, but we just want to know that we provide abstinence education from a neutral perspective as well, particularly when we talk to our younger kids. um and it's something that anyone can choose at any time. Anyone can choose to be abstinent, and we support that. So with that being said, um
Oh, I'm so sorry. I had myself muted, but definitely I agree with everything you just said.
all right, cool. Not a problem. I want to thank you for being on the show.
Thank you for
Uh,
having me.
really appreciate you coming on tonight and um, talking about what some of the challenges that we're facing in the community, and also the things that we can do to overcome those challenges now on into the future. And we have lots of work to do, and you have lots of work to do.
Oh, yes, I sure do.
So we're going to continue to work this through, and from time to time we'll be asking you back on to share some perspective with our community, and
Definitely.
and to continue to provide education and provide resources. So thank you again.
No, thank you. It was a pleasure.
And ladies and gentlemen, if you are out there, if you are absolutely out there and you are in need of HIV counseling, HIV testing, HIV education, HIV screenings, um, absolutely reach out to us. We would love to provide you with resources. We can provide you with those services as well. Our number is right here. Give us a call. And also, you can check us out at www.campbellhealth.org. We look forward to hearing from you. And please continue to like, share, and subscribe. If you have further questions, please put them in the comment. We'll definitely be able to see them and respond. And we look forward to seeing you soon. Bye.